Please consider supporting our channel by liking this video and subscribing for more content. Unmasking the silent killer, understanding ischemic heart disease and its impact on cardiovascular health. Ischemic heart disease, also known as coronary artery disease, stands as a formidable challenge to global cardiovascular health. It is a condition characterized by the narrowing or blockage of the coronary arteries, leading to reduced blood supply to the heart muscle. With its prevalence steadily rising, understanding the intricate mechanisms, risk factors, and consequences of ischemic heart disease has become paramount. This video delves into the multifaceted nature of the disease, exploring its underlying causes, diagnostic methods, treatment options, and the significant impact it has on individuals, families, and society as a whole. By unraveling the complexities of ischemic heart disease, we can strive towards effective prevention, early detection, and comprehensive management strategies, ultimately working towards a world where hearts beat stronger and healthier. Ischemic heart disease, IHD, is primarily caused by atherosclerosis, a condition characterized by the buildup of plaque in the arteries supplying blood to the heart. The plaque consists of cholesterol, fatty deposits, calcium, and other substances that accumulate on the inner lining of the coronary arteries, causing them to narrow and harden over time. Several factors contribute to the development of atherosclerosis and subsequent IHD. These risk factors include high blood pressure. Elevated blood pressure puts strain on the arterial walls, making them more susceptible to damage and the formation of plaque. High cholesterol levels. Increased levels of low-density lipoprotein, LDL, cholesterol, often referred to as bad cholesterol, can lead to the accumulation of plaque in the coronary arteries. Smoking. The chemicals in tobacco smoke can damage the inner lining of the blood vessels, promoting the development of atherosclerosis. Diabetes. Individuals with diabetes are at a higher risk of developing IHD due to metabolic abnormalities that accelerate atherosclerosis. Obesity and sedentary lifestyle. Being overweight or obese and leading a sedentary lifestyle are associated with increased cholesterol levels, high blood pressure, and diabetes, all of which contribute to IHD. Family history. Having a family history of IHD or early-onset heart disease can predispose individuals to developing the condition. Age and gender. As individuals age, the risk of developing IHD increases. Men are generally at a higher risk until women reach menopause, after which their risk becomes comparable to that of men. Other factors that may contribute to the development of IHD include stress, excessive alcohol consumption, poor diet, high in saturated fats and trans fats, and certain medical conditions such as chronic kidney disease. It is important to note that these risk factors can interact and compound each other's effects, further increasing the risk of IHD. While some risk factors, such as age and family history, cannot be modified, many others can be managed and controlled through lifestyle modifications and appropriate medical interventions. Ischemic heart disease, IHD, can present with various symptoms, and the severity and type of symptoms can vary among individuals. Some common symptoms of IHD include 1. Angina. Angina is the most typical symptom of IHD. It is characterized by chest pain or discomfort, often described as a squeezing, pressure, heaviness, or tightness sensation in the chest. The pain may radiate to the arms, usually the left arm, shoulders, neck, jaw, or back. Angina is typically triggered by physical exertion or emotional stress and is relieved with rest or medications like nitroglycerin. 2. Shortness of breath. IHD can lead to reduced blood flow to the heart muscle, resulting in inadequate oxygen supply. This can cause breathlessness or a feeling of being unable to catch one's breath, particularly during physical activity or exertion. 3. Fatigue. Individuals with IHD often experience persistent fatigue or a general sense of tiredness, even with minimal physical exertion or at rest. This fatigue may be due to the heart's reduced ability to pump blood efficiently. 4. Palpitations. Some individuals with IHD may experience palpitations, which are rapid or irregular heartbeats. Palpitations can be unsettling and may be accompanied by a sense of fluttering or pounding in the chest. 5. Sweating. Excessive sweating, particularly during episodes of angina or physical exertion, can be a symptom of IHD. It is important to note that some individuals, particularly women and older adults, may experience atypical symptoms or no symptoms, known as silent ischemia, despite having IHD. In these cases, the absence of symptoms can make the diagnosis challenging, underscoring the importance of regular health checkups and appropriate screening tests for early detection. If you or someone you know experiences any of these symptoms or suspects IHD, it is crucial to seek medical attention promptly. Only a healthcare professional can provide an accurate diagnosis and recommend appropriate treatment based on a comprehensive evaluation of symptoms, medical history, and diagnostic tests. Ischemic heart disease, IHD, can lead to several complications, some of which can be life-threatening. These complications arise due to the reduced blood flow and oxygen supply to the heart muscle. Here are some common complications associated with IHD. A heart attack, myocardial infarction. A heart attack occurs when the blood flow to a section of the heart muscle is completely blocked, usually due to a blood clot forming on top of a ruptured plaque. This results in the death of heart muscle cells in the affected area. Heart attacks can cause severe chest pain, shortness of breath, sweating, and other symptoms. Prompt medical intervention is critical to minimize damage and preserve heart function. Heart failure. Chronic IHD can weaken the heart muscle over time, impairing its ability to pump blood effectively. This can lead to heart failure, a condition where the heart cannot meet the body's demands for blood and oxygen. Symptoms of heart failure include fatigue, shortness of breath, fluid retention, resulting in swelling of the legs, ankles, or abdomen, and reduced exercise tolerance. See arrhythmias. IHD can disrupt the normal electrical impulses that regulate the heart's rhythm, leading to abnormal heart rhythms or arrhythmias. Arrhythmias can manifest as a rapid heart rate, tachycardia, irregular heartbeat, atrial fibrillation, or other disturbances in the heart's rhythm. Severe arrhythmias can result in palpitations, dizziness, fainting, or even cardiac arrest. Angina. Unstable angina or acute coronary syndrome. In some cases, the plaque within the coronary arteries can become unstable, leading to the formation of blood clots that partially or completely block the blood flow to the heart. This can result in unstable angina or acute coronary syndrome, which presents as severe or prolonged chest pain that may occur at rest or with minimal exertion. Prompt medical attention is essential to prevent a heart attack from occurring. Sudden cardiac death. In advanced stages of IHD, the risk of sudden cardiac death increases. Sudden cardiac death refers to a sudden, unexpected loss of heart function, typically due to a life-threatening arrhythmia. It may occur without prior symptoms or warning signs. Other complications. IHD can also contribute to other complications, including heart valve problems, aneurysms, abnormal bulges in the blood vessels, and increased risk of blood clots, which can lead to stroke or peripheral artery disease. It is important to note that the risk and severity of complications can be reduced through appropriate management of IHD, including lifestyle modifications, medication adherence, and, in some cases, interventions like angioplasty or coronary artery bypass grafting, CABG. Regular medical follow-ups and adherence to the prescribed treatment plan are crucial to minimize the risk of complications and improve overall outcomes for individuals with IHD. The treatment for ischemic heart disease, IHD, aims to relieve symptoms, improve quality of life, prevent complications, and reduce the risk of heart attacks and other cardiovascular events. The specific treatment approach will depend on the severity of the disease, the presence of symptoms, and individual patient characteristics. Here are some common treatment strategies for IHD. Lifestyle modifications. Healthy diet. Adopting a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats while limiting saturated and trans fats, cholesterol, and sodium. Physical activity. Engaging in regular aerobic exercise, such as brisk walking, cycling, or swimming, for at least 150 minutes per week. Smoking cessation. Quitting smoking and avoiding exposure to secondhand smoke. Weight management. Maintaining a healthy weight through a combination of balanced diet and regular exercise. Medications. Antiplatelet agents. Medications like aspirin or clopidogrel may be prescribed to reduce the risk of blood clots and prevent heart attacks. Statins. These medications help lower LDL cholesterol levels and reduce the risk of plaque formation and progression. Beta blockers. These drugs reduce heart rate and blood pressure, relieving strain on the heart and improving symptoms. ACE inhibitors or ARBs, these medications are prescribed to control blood pressure, improve heart function, and reduce the risk of complications. Nitroglycerin, it is used to relieve angina symptoms by dilating the coronary arteries and improving blood flow to the heart. Procedures and interventions. Percutaneous coronary intervention, PCI, this procedure involves inserting a stent into a narrowed or blocked coronary artery to improve blood flow. Coronary artery bypass grafting, CABG, in more extensive cases, bypass surgery may be performed to create alternate routes for blood to reach the heart, bypassing blocked arteries. Enhanced external counterpulsation, EECP, it is a non-invasive procedure that can be used to relieve angina symptoms by improving blood flow to the heart. Cardiac rehabilitation, a comprehensive program that includes supervised exercise, education, counseling, and support to help individuals recover from a heart event, manage risk factors, and improve overall cardiovascular health. It is important to note that treatment plans will be individualized based on each patient's unique needs and may involve a combination of the above strategies. Regular follow-up appointments with healthcare professionals are essential to monitor progress, adjust medications, and manage risk factors effectively. In conclusion, ischemic heart disease, IHD, is a condition characterized by reduced blood flow to the heart muscle due to narrowing or blockage of the coronary arteries. It is a leading cause of heart attacks and can have significant impacts on an individual's health and well-being. Recognizing the risk factors associated with IHD and implementing preventive measures, such as lifestyle modifications and medication adherence, is crucial for reducing the incidence and severity of the disease. Prompt diagnosis, appropriate treatment, and regular medical follow-up are essential in managing IHD effectively, improving symptoms, preventing complications, and enhancing overall quality of life. By adopting a holistic approach that combines lifestyle changes, medications, and interventions, individuals with IHD can optimize their heart health and reduce the risk of future cardiovascular events. Help us reach a wider audience by liking, sharing, and subscribing. Your support goes a long way in helping us create more awesome videos.